Well, good morning. Today, the agenda for the first Executive Committee of 2021 is being released, and there are many important items on the agenda, but I want to focus on one in particular this morning. The report on Cafe TO should give us all some hope as we plan for the spring, and spring is not that far away, notwithstanding how it seems some days, and of course the summer to come after that. While we're currently in lockdown and in the midst of winter, the planning work is well underway now to make sure that if people keep following public health advice and we stop the spread of COVID-19, that everything will be in place to support expanded outdoor dining once again as the weather gets better. Throughout the pandemic, we've worked hard to give businesses some of the extra support they have needed so badly to be able to stay open more often or to be able to expand their opportunity to serve customers and, quite frankly, expand their opportunity to take in much-needed revenue. Cafe TO is an example of that help, something that the city government could uniquely provide with the help of restaurants themselves and the business improvement areas, the BIAs, an initiative that so many people embraced so wholeheartedly, both restaurants and members of the public. And so I think it was a win-win for everybody. I made a commitment to help the entire restaurant and bar industry in Toronto on a go-forward basis, and this report demonstrates that we're following through on that commitment. We commissioned this very report last year when the main season for outdoor dining ended, so that we could ensure that Cafe TO installations can be installed as quickly as possible in the spring, and so that we could bring about improvements wherever we could in that program. Last year, in 2020, 801 restaurants in 62 business improvement areas across the city. So that's really 62 business neighborhoods, 62 different kind of main streets for small businesses, plus 96 restaurants outside of BIAs took part in Cafe TO. An additional 44 public parklets were also activated. We rolled out 439 curb lane closures that converted into 9,683 meters of traffic lanes that became new outdoor dining space for restaurants. What was a quick start program in response to the pandemic, the Cafe TO program became very popular with people, but in also helping local bars and restaurants to stay in business and to take in revenue at a time when they badly needed it. People loved it, plain and simple. We did some surveys of restaurants and of the public. 90% of those surveyed were very satisfied or satisfied with their patio experience. 66% of restaurant operators said their restaurant would not have been financially viable were it not for the Cafe TO program. 95% of restaurant and bar owners and members of the public said that they wanted to see Cafe TO back on the streets of Toronto in 2021. I am determined to continue this program this year with City Council support. And of course, this report, assuming it's approved by the Executive Committee, will go on for approval, hopefully, at City Council. This was my intention from the very day that it came to an end in 2020, but I did feel that it was appropriate that we could review the program and make sure that we made it easier for people to participate in and made some improvements to it as we have done. So the city staff, of course, did, as they always do, did the work of the review over the course of the fall. They learned some important lessons, and they are now recommending some improvements to the Cafe TO program as we would hope to see it rolled out for 2021. The report released today outlines key findings and outcomes from the program that helped hundreds of restaurants and bars in our city last summer. This program alone infused our city with vibrancy and community when we needed it the most. There were people who said to me when I announced it and announced that we would be, taking some lanes of traffic and repurposing them for this, that it would be the end of these main streets and neighborhoods. And in fact, it brought those neighborhoods to life. And some of those very same people have told me that we were right in moving forward with this. And that's beyond all the joy that it provided people in terms of the quality of life in our city. It was a win-win. We helped a restaurant and bar industry that was struggling. We helped to protect jobs, and we did something which I fundamentally believe improved the quality of life in our city, pandemic or not. Keeping it and making it better is the right thing to do, and I believe that the residents of the city and the businesses are strongly behind this decision. Both safety and accessibility remain paramount for our consideration as we relaunch Cafe TO for 2021. I've been assured that program staff are committed to using the feedback they've heard from the accessibility community in particular to improve the program for everyone. Beyond that, we will work with the BIAs and with businesses to make the program better by focusing on an updated registration process that will be even simpler and more straightforward. We tried to make it that way last year, but it was put together quite quickly. Developing comprehensive and safe traffic management plans. Again, there were concerns expressed by people about the proximity they had. It was something they weren't used to in Toronto, proximity to traffic. We want to make sure that when we use the curb lanes, as we will again, that it is as safe as possible, and that is for the people dining, but it's also for the employees and for the users of the road. And we want to make sure that we support the quick installation of Cafe TO installations. We will facilitate more platforms and decks this year. That's also a part of addressing the accessibility question. We want to make sure that we can begin helping approved businesses to get on with having this extra space available to them as soon as possible. The report also calls for fees to once again be waived this year so that operators don't have to take on that additional burden when, let's be frank, restaurants and bars will still be just trying to recover from the hole that they've been put in by the pandemic. So this will give us an opportunity to get those things done quickly and let them get on with having extra spots for customers to sit and for us all to have the joy of being able to sit on those patios. I fully support this. Restaurants and bars are vital to our main streets. If you think of the thing that brings traffic on a daily basis, people coming and going at all hours of the day and night, they are fundamental to the health of our neighborhood main streets, if I can call them that. It is an enhancement to our neighborhoods that I want to extend. I want to extend it both in terms of it being a program that repeats itself, but also in terms of ways we can make it better. Under this year's plan, at my urging, the first approved locations for 2021 could be installed in May, almost 2 months earlier than when the program was launched last year. And some people may say, well, why not even earlier than that? Well, we do have to have time to do the spring cleanup, and if you don't do that kind of thing and clean out the catch basins and all the different kinds of things we have to do to get ready for the summer and the storms and so on, this is something that could be cause a new difficulty for us that's almost worse than some of the ones we're trying to fix. Sidewalk cafes will also continue to be permitted. Depending on individual and local circumstances, we believe much of the setup work can be done ahead of the Victoria Day weekend so that we will be able to be ready with this program for the unofficial start of summer and patio season. Following Executive Committee and City Council approval, the first registration window for Cafe TO curb lane patios will open next month. This will all ensure that Cafe TO 2021 will be bigger and better and even more user-friendly for this year. I hope this news provides some relief and some sense of positive anticipation and hope for the businesses and for the people. I mean, the people are looking for something to smile about, and just thinking ahead to days spent and time spent on patios, especially these expanded patios, I think will bring a smile to people's faces, but I hope it will also give a sense of hope to the very hard-hit restaurant and bar sector. 2020 was an extraordinarily tough year, and of course the beginning of 2021 has been no different, whether it's for individual people or for people who are in business. I think 2021 can be much better, but we still have some work to do, of course, battling this virus. And Cafe TO is going to be a key part of that hope and of that anticipation going forward, and one of the benefits that will flow in a more obvious way as we proceed with fighting the virus and also with getting vaccinated. And I hope that, in fact, the hope of days to come in the summer on these patios will be a motivation for people to follow the public health advice, to stay home, to make sure they get vaccinated when the time comes. Now, the report also provides an update on another important program we launched last spring in response to the ongoing pandemic, and that is the Curb TO program. It is still and was then a sensible and worthwhile program that has supported many businesses that were struggling outside of restaurant, but not excluding them, because there was a lot of pickup of takeout food as well. There remain more than 100 Curb TO temporary parking pickup zones in place across the city. They've stayed in place through the different phases of lockdown to support these Main Street businesses so that they can provide curbside pickup and delivery. It is a program that has been welcomed by many businesses and one that we are planning on keeping. The report ensures that the Curb TO program will remain available as needed and in a way that best supports public health guidelines. None of these programs, I should say, would be possible without the help of our partners, and that includes, I'll start with, just because they have done a lot of work here in a very short period of time, both the implementation last year and the review, and that is our city staff. who just worked incredibly hard to make this happen at a time when it hadn't really been contemplated as something as wide-scale as it was. But I also want to thank the Toronto Association of Business Improvement Areas, BIAs, TABIA it's called, and the individual BIAs who worked very closely with the city staff, and the individual business people who in many cases were patient as we went about doing something that we had never done before. So I want to say thank you to all of those partners. We will have more to say about some of the other programs introduced during the pandemic in the coming weeks, but it's worth highlighting today the work that is being done to help people get through the pandemic. I know that the health measures that are in place can make life difficult in many different respects, certainly for business, but also for individual people. But they're absolutely necessary to protect the health of Torontonians until we get the numbers better, and that is, of course, going to be helped by the vaccine and the supply of the vaccine and all the efforts that we're preparing to make to get Torontonians vaccinated. Our work at the city continues to be to do everything possible that we can to make life as easy as possible for people within these public health measures, and to continue to provide services to people, especially to our most vulnerable, as we go through the continuation of this most difficult period. I will say to you that as I spend more and more of my own time through the budget and through other means preparing for recovery and preparing to help get the city back on its feet as fast as possible, that I'm reminded every time I go through a meeting on any of these subjects that the city is strong. The city is strong. The city has proven itself to be strong and resilient during all these months, but the city is strong in terms of its fundamentals. And I am absolutely confident in our ability to recover strongly if we can just get through this very difficult pandemic winter. We need to resolve to continue to stay home, and there's some encouraging aspects to the data we see from phones and from traffic that tell us that that is happening to a greater extent, but there's still more work that can be done in that regard. People should have hope, though. You know, spring is a time of hope and a time of renewal, and spring, well, it still seems far away when you're in January. It's getting closer by the days. The days are, I think, getting a minute and a half longer every day, and these tiny little things are reason for hope, and it's the hope that as well comes with the vaccines, the hope that comes from hearing me say that we're going to have those wonderful sidewalk and curb lane patios again this coming summer to enjoy, and this is all going to be helpful to help us to recover personally, but also to help us to recover as a city and make sure that we can keep making Toronto a better place to live. Because in the end, this is a program I hope will carry on, you know, when I say forever, you know what I mean by that, for years and years to come. And it's just going to make this a better place to live, just plain and simple. So that's the update on that for today, and I'm happy to take your questions on any other matter or this that are of interest to you today.
Thank you for joining us today. As a reminder, it's one question, one follow-up. We also do have staff on the line if you have any technical questions, including Carlton Grant, Jody Callan, and Barbara Gray. As a reminder as well, please unmute yourself when you're called upon. First up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, good morning, and thank you for helping me think about patios today. I just want to ask about vaccines, though, and specifically the vaccine clinic. It was supposed to go for as long as 8 weeks. Now we know it will end after just 2 days. I'm wondering how concerned you are about the preparations, or how prepared the city will be for vaccines outside of a hospital setting, since this program was to write the playbook, and what you're going to do to make up for the setback.
I think helped by the fact that in the City of Toronto we've had to have fairly large vaccination programs before for, say, the flu and for the H1N1 because of the size of our population. We had some existing playbooks that needed to be updated, and I can just tell you that I asked that a task force be formed back in the fall, before there was even a vaccine identified, to say that we knew we would have to be ready. And so I will just say the City of Toronto, under the leadership of Chief Pegg, will be ready. And we operate within the framework of the supply from the federal government and the guidelines and prioritization of the provincial government. We will be ready as a city, and we didn't learn all the lessons that we had to learn because of the premature closure of this proof of concept clinic due to a lack of supply, but we will continue to learn as soon as that supply is available.
And on just the revelation that 8 people were able to get the vaccine at that clinic that weren't supposed to, I'm just wondering how concerned you are, especially with the perception of the mix-up, dealing with the fact that we have vaccines in such short supply right now.
You know, 8 people, because of a problem with the sort of information dissemination to those groups that were meant to be vaccinated did get vaccinated. But, you know, the key on these kinds of things is not so much what was the problem, but how did you react to it? We reacted immediately, you know, I think made the necessary changes to make sure, and this was one of the kinds of lessons that was to be learned by a proof of concept on the information system and on the clinic itself. I should point out that at the same time as those 8 people may have, you know, slipped through the system, and that was remedied, more than 60 people actually just saw the news on TV about the clinic and showed up and just said, I'm here, you know, can I get vaccinated? And we had to tell them it was for groups of people that there was going to be, and that's a lesson you learn, is that when you see things on the news about a clinic opening, a lot of people will just hear that part and not hear it was for people in a particular order or a particular day or a particular age group. So that's a lesson for us as we roll this out to 3 million people. But, you know, I think it was very well handled. It was just a problem that arose, and we knew there would be problems, and that's why we were having a proof of concept clinic as opposed to just sort of opening them all up on the day when millions of people are going to be coming in groups to get vaccinated.
Thanks, Matt. Next up, we have David Ryder from the Toronto Star. Go ahead, David.
Hi, Mayor Tory. People are anxious for cafes. They're also anxious for the active TO program. I haven't heard anything today about when we're going to have road closures and other things encouraging people when the warmer weather comes beyond what's being done now with the parks. Is that for May as well? And what can you tell us about that?
The active TO program is something I'm equally enthused about. It will be back. I hope it will become a feature of the city in years to come because we learned a lot of positive lessons about that. What makes it a bit more complicated is that in order to decide where you're going to have active TO, it's affected by things like major construction projects that mean that just to say, well, we'll just do it the same place as we did it last year at the same time and all that kind of thing, it isn't that simple. So we're working our way through the impact of construction projects that weren't there last year that will be there this year and things like that. And I would hope that, I think around the 1st of March, we're expecting a full report to come forward that will indicate that that program will be here once again. I hope even to see the possibility of it being put in other parts of the city as well, if we possibly can.
Thank you. And my follow-up is about the report about Smart Track. So we've got 2 stations who were previously on Smart Track that are now not happening, and it says because the subway program is going to make them redundant. And then we've got another station that doesn't seem to be on the same line as the other Smart Track ones being branded Smart Track. So I guess my question is, does Smart Track really exist? And is this just an attempt to sort of keep your campaign promise alive?
Well, I think if you look at the map that has 7 new transit stations on it, on the very line that was talked about, yes, it's absolutely different. But the bottom line is the soonest of any of the major transit projects that are now underway, except for the Eglinton Crosstown, which started before I was mayor, we will have 7 new transit stations in 2026. That is later than was originally conceived. It's different than was conceived, but I think when you add together the Eglinton East LRT, the Eglinton West LRT, which is proceeding, you add in the new Smart Track stations on GO Train tracks that existed before, and you do it within a time frame that's going to be sooner than the other major transit projects. These are 7 new stations that will serve the people of Toronto and that will get done. And so, yes, it's different. Yes, it's happening at a different time, but it's happening, and I'm going to make sure it does happen.
Thanks, Dave. Next up, we have Lucas Myers from News Talk 1010. Go ahead, Lucas.
Thanks, Aladdin. Mayor, to go back to the center, obviously you can only go with what the supply is of the center, but this has been 250 people a day for 6 weeks, down to okay, we have to stop on Friday, to now we have to stop on 2 days. Just purely from you wanting to get these vaccinations done as soon as possible for people who need it, and now to stop after only 2 days, just your kind of emotional reaction to that the biggest city in the country and this site that you were so excited for has to stop because of this issue.
It's immensely frustrating, but it's also something over which the city in particular has very little control, and I would say even the country doesn't have that much control. I mean, if the vaccine was made in the basement of Parliament Hill or Queen's Park or City Hall, I would say, well, then we might have more control over it. But the fact is, it's not. And so I think all we can do is to try to advocate as best we can to make sure that our supply is enhanced and that it comes as soon as possible. But I can just tell you, our job at the city, the feds responsible for buying vaccine, the province for distributing it and setting the rules on who gets vaccinated when, our job is to be ready when the supply is ready to get those needles into those arms. And we've been working on that for months. We will continue to do our work on that and get these clinics up and running as soon as we're able to do so with proper supply.
And my follow-up, Mayor, is that the other element of what Nat alluded to with regards to those people who got vaccinated when they shouldn't have, as well as there were some others who actually were improperly registered but were turned away at the door, is that this link that they were able to sign up through was inappropriately shared, basically, among some healthcare workers who really shouldn't have seen it and should not have gone in the first place because they weren't part of the priority list. So what's your message moving forward for people on the importance of the priority list, and that those who need the vaccine most at the beginning, such as those who are interacting with long-term care and city shelters, they are prioritized?
This is one of the lessons learned in the first 2 days, is that, there should have been and there will now be going forward some protection, like I'll call it like a password type protection that says that a link can't be shared. I don't blame the people who got the link and somebody said to them, hey, you've got this link, you can go sign up for an appointment, and how would they know necessarily any better, even though they'd probably read in the newspaper that there were certain very specific groups. These were people who, by and large, I think worked in the healthcare area. So I think these are the lessons you learn. And I think that we're going to have to be really explicit in communicating who is getting vaccinated when, making sure that when you go to the link to make an appointment, that it's very clear that there has to be some sort of password or other security measure that is better than obviously was there. But I can just tell you, when we learned about this, we moved very quickly to address it, and I think had we had the rest of the week or even the 6 weeks to run the clinic, we would have found that that wasn't a problem anymore. In fact, maybe the bigger problem based on the numbers was people just saw the news of a clinic on TV and took the subway down and showed up. And we have to get across to people that when the vaccination happens for millions of people, it obviously all can't happen the same day. And it's going to be done in groups by age and by different other categories, and people are going to have to, we're going to have to make sure they know that information and that they focus on that.
Thanks, Lucas. Next up, we have Christina from CP24. Go ahead.
Everyone, thank you. Good morning. Mayor and staff, I'm wondering if you have any numbers as to how many businesses and restaurants that were part of Cafe TO last summer maybe haven't survived since because of the most recent lockdown.
I don't have those numbers. There are some staff people on the line. If any of them does have it, they could perhaps speak up. I doubt we do, but they may. Anybody
or
on
any
there?
sense even.
Jody or Carlton, do you want to go ahead?
So it's Carlton here, and it's difficult to tell if restaurants have made it through or not. We'll have a better idea later on in the year as we do license renewals. But what I can tell you is this has been a huge lifeline for many restaurants. The economic impact was up to $50,000 a month for those that participated. For some year-over-year expenditures from 2019 to 2020 only fluctuated down 5,000 and 1 month up 45,000. So people were able to keep pace with their previous years, and they were allowed to generate revenues, and really importantly, as the mayor states, to keep employing staff, both part-time and full-time servers and kitchen staff, which is really critical.
You know, this program really is the ultimate proof, even if there were a couple that didn't survive, which I'd be deeply distressed by, but this is the proof that there is indeed a silver lining in most clouds. Jobs were retained, businesses were saved, I don't think it's an exaggeration to say that, and the quality of life in the city was improved for people. You know, they enjoyed those patios. I can't tell you how many people came up to me to say this was a really good thing that happened to our city, and that's why it's not just a pandemic measure in my view. I think it's something that we'll be having in one form or another for years to come.
Okay, thank you. And Mayor, today the Ministry of Labor announced that they're going to be expanding their workplace blitzes, adding another 300 officers, and they're going to once again target big box stores, restaurants, and other establishments that are essential like gas stations. York Region has named those who were fined for breaking the rules. Costco, for example, Shoppers Drug Mart. Will the City of Toronto do the same, and do you see any benefit to that?
Well, first of all, may I just say that I commend the province of Ontario, the Minister of Labour and his department for the fact that they're proceeding to do these inspections with such rigor. We've been doing the same kind of thing with different kinds of inspections throughout, and I think it's been very helpful to remind people of their obligations under the public health restrictions that are in place. You know, my view is that these big box stores should actually be closed except for grocery sales, but I guess if there's a second best, it is to have these kinds of rigorous inspections. With respect to the question of naming, I perhaps will ask Mr. Grant to comment on that. I've been told when I've been asked about that sort of thing in a broader context that there are different kinds of restrictions that exist on what you can put out and not put out, but perhaps he would like to address that.
Sure, and thank you for the question. We typically do not name them, as these are charges that are going before the courts, and we do not want to prejudice the court process by having it battled out in the media. So I understand the desire to publicly shame these businesses and to not have them supported. They may be small, minor infractions, and again, we don't want to be impacting the economic impact of some of these larger stores, but in general, we typically do not name in the effort to not prejudice the court process.
Thank you. Next up, we have Mark McAllister from City News. Go ahead.
Good morning. Hopefully you can hear me okay. Mayor, I'm wondering if you can provide more details on another agenda item for the executive next week, and that is the community crisis support pilots. If you could offer when those will happen, how those will happen, and what will be involved.
I'm very pleased that we're moving forward. And if you think about the short period of time that the city staff had to examine the question of an alternate response model other than just sending the police to people who are in crisis, having issues with mental health, I'm very impressed at the speed with which this work has been done. The proposal that will be in front of the executive committee, which would involve an entirely separate non-police founded response for people who are in crisis, most of them, will come to the executive committee with then the important part of this, and it's a part that I've tried to emphasize throughout this entire discussion. When you move to a situation that has an alternative to the police, a different group of people responding, mental health professionals, you need to have those people in place. You need to have the agencies, contracted, as it were, or people contracted to actually respond to those calls. You need to set up the intersection between the 911 call center and perhaps some mental health professionals taking some of those calls and in turn dispatching this new organization as opposed to just dispatching police officers. And so that work will be done in 2021, and then it will be rolled out into, I get mixed up with all the different things we're doing, but I think it's either 3 or 4 areas in the city where you will use this method of response for many of the calls presently handled by police only. And I think we're optimistic that concurrent with the information we've received from the studies that they've done very quickly in other jurisdictions, that this will have a positive impact on the outcome of those kinds of calls because you have mental health professionals in many more cases. In the meantime, during 2021, within their existing budget, the police have found money to basically double the number of mobile crisis intervention teams, which consist of a police officer and a mental health professional, whereas this new proposal would have pretty well exclusively mental health professionals, with the police only being involved as needed if there was some part of the episode that required them. So I'm actually very happy about the fact that we've come this far, that we're going to be moving forward with these pilot projects and then hopefully making this a permanent citywide project as soon as we possibly can.
Thank you very much. On another note altogether, the ongoing debate over what is considered essential or not essential during the stay-at-home order from the province. I'm wondering if you might be willing to chime in on a particular industry. There are thousands of people in Toronto that are working in the film industry in close quarters, on sets, and in studios. Why is it that they are considered essential and allowed to continue to operate?
Well, I think the most important thing to take note of in their case was that they put in place an incredibly rigorous, thorough safety and health protection program to apply to those sets and those places where they were conducting this kind of filming activity. and there are very strict restrictions on the number of technicians and so on that can be on a site at a given point in time, and other requirements with regard to mask wearing and things like that. And I think that the main point to be focused on here is that I think the governments, and in particular the province, in putting together the various regulations and orders, have taken account of the degree to which it is possible to protect people from a safety point of view, and tried to keep as many people working as possible. That's been part of that balancing act we've all had to do, because we don't want to shut everything down if it is safe for people to work, just as we didn't want to shut the skating rinks down if we could make it safe for people to skate, which we've tried to do. So I think that in the case of the film industry, every indication I have is that the requirements that are in place here to protect the safety of the film workers and others is as rigorous as anywhere else in North America, and that what you've had is almost no cases. I think it's literally virtually zero cases coming out of that industry or anything associated with it during the time of the pandemic.
And last question is Natalie Johnson from CTV. Go ahead, Natalie.
Good morning, everyone. Sir, I'm just wondering, as you know, a lot of people who were vaccinated at the MTCC clinic these past couple of days were shelter support workers, harm reduction workers, et cetera. Not to suggest that they're not deserving of the vaccine early on, but why would they have been the test group for the MTCC clinic ahead of, say, doctors and nurses who are working directly in ICU wards or hospital floors with COVID outbreaks who are still waiting on the vaccine? Is it just that the city was in charge of vaccinating people who work directly for the city?
Well, as we will do with every aspect of prioritizing groups to be vaccinated over the whole of the vaccination rollout through the summer months, we are guided by the province in terms of groups that they feel are fitting within the overall structure. And as you know, many healthcare, frontline healthcare workers were dealt with in the hospitals with vaccination efforts they undertook. Some others were dealt with in the long-term care residence setting itself. And so on. And so this was a group of people who are very much frontline workers in circumstances where they're going to be exposed or expose themselves to the clients that they're dealing with. And so I think it was felt in consultation with the province, who asked us to run this clinic, that these were appropriate groups to fit within what was intended to be, and is intended to be, a continuing vaccination program to eventually cover everybody in long-term care, in frontline health, in frontline jobs that involve contact with people like shelter workers. So I think that this was something that was considered, and I think it would have gone, frankly, without notice had it not been for the fact that it was interrupted, because it was part of an overall program.
Thank you so much. My other question is, obviously the vaccine supply numbers are changing by the day, but do you have a sense at this point whether the city's phase 3, I suppose, of rolling out the vaccines into priority neighborhoods, for example, will be impacted by this initial shortage, or are you confident at this point that the shortage is just a short-term issue?
I will say that the preparations that we had been making since the fall, before there even was a vaccine, to have clinics, different kinds of clinics and other kinds of distribution points, some of which are under the direction of the province through physicians and through places like that, that preparation work is still underway with us, and it's well advanced. And so I think the chief indicated in our last media avail on Monday that there would be some pushback, some delaying of some of those dates because of the interruption that's taken place in supply and some of the notifications we've been given about supply from the federal and provincial governments. But our work will continue so that whenever the supply is available, we will be ready. And we will be ready at the earliest possible date. So if supply by any chance gets accelerated in future weeks as they put new production lines in place and so on, we will be ready to do whatever the city is required to do as part of the process of getting needles into arms and getting as many people of the 3 million vaccinated as quickly as we possibly can.
That's the last question.
If this is the last question?
Yeah, it's done now. If you want to go
Okay,
ahead.
I want to just say one thing, that I wanted to comment on something in anticipation of being asked. I thought I'd wait, but I will comment anyway. I just want to say, in regard to the activity that is happening on Eastern Avenue, that I am a strong supporter of building affordable housing and having it built as quickly as possible by as many people as possible. And I think the efforts we've been undertaking as a city with Housing Now and with Open Doors and with the activities we're doing with the federal government on the Rapid Housing Initiative are a good indication. We have thousands of units in the pipeline now under construction, some like the modular housing people have already moved into. I do understand, though, that while we have to do this as quickly as possible, it always has to happen with a degree of community consultation, because any housing that you build is being built within an existing neighborhood and has some impact on that neighborhood, hopefully all positive, but I think it's important to learn some of those lessons. With respect to the particular issue that is in front of us on Eastern Avenue, I have expressed to the Minister and have indicated our wish to have a degree of an additional and a degree of consultation beyond what really hasn't happened thus far, and that would include us seeing some of the studies they have done, and they've confirmed that in writing. They've done heritage-related studies, and to see those, and to maybe learn a lesson from this, that while we want these projects to move forward quickly, this is on their land, and so on, we also want to make sure that we can do this hand in hand with our neighborhoods, hand in hand with the city, and that I think in this case, as in other cases going forward, a degree of consultation between the city and the province, regardless of who owns the land or what mechanism is being used to move this housing forward, which we very much want to do, is something that is desirable and necessary. And so I will look forward to continuing discussions with the government in that regard and with the minister, but I certainly think that that consultation needs to take place and that I think creative minds can find a way to address some of the concerns that people have and some of the desires we all have to build affordable housing as quickly as possible, as much as possible, but do it within the context of things like neighborhood compatibility and things like heritage.
That's it for
Thank you very
today.
much.
Thanks, everybody. Have a great day.